Hand hygiene. Hello, my name is Jose. I'll be your student nurse today. I'm here to conduct a head-to-toe assessment. At any point, please let me know if you feel uncomfortable. Can you state your full name and date of birth?
January 6, 2003.
Is there any allergies that I should be aware about?
No.
How do you identify as?
Male.
How old are you?
21.
Do you know where you are today?
Carla's house.
Do you know what day of the week it is?
Monday.
What brings you in?
A checkup.
Perfect. I'm gonna go ahead and begin by assessing your eyes, okay? Go ahead and look into the light. Into the other eye. Go ahead and look right here. Perfect. Go ahead and close your eyes. I'm gonna be touching you with a pen. Let me know if you feel it, okay?
I feel it. 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 I feel it.
Excellent. Can you go ahead and stand up for me? Walk to the couch regularly. On the way back, on your heels. On your tippy toes. Heel to toe. Excellent. Brian, male, appears as stated age. Is alert and oriented times 4. Speech is clear and coherent. Hearing is intact. Patient's posture and facial expressions are appropriate for visit. Facial features are symmetrical bilaterally with no deformities. Patient's pupils are 2 millimeters dilated bilaterally. General movements are purposeful. Gait is smooth and rhythmic with opposing arm swings, and upper and lower extremities sensation is intact. I'm gonna go ahead and look at your chest, okay? Upon inspection of the chest, skin matches that of ethnic background with no lesions or deformities. I'm gonna go ahead and listen to your heart sounds, okay?
Okay.
Starting with the starting with aortic, pulmonic, herbs, tricuspid, and then mitral. Gonna go ahead and wait here for 10 seconds. Okay, flipping the bell, going backwards. Mitral, tricuspid, herbs, pulmonic, aortic. Apical pulse is 86 beats per minute, regular rate and rhythm with S1, S2 present. No S3 or S4 or other murmurs noted. I'm gonna go ahead and inspect your thoracic cavity from the front side and the back side. Okay. Upon inspection of the thoracic cavity, skin matches that of ethnic background with no lesions or deformities. Thoracic shape is elliptical and symmetrical bilaterally. Respiratory rate and pattern are even with no work of breathing. Patient is eupnic. I'm gonna go ahead. Is it okay if I can touch you? Let me know if there's any tenderness or pain. Okay. Upon palpation of the anterior and posterior thorax, skin is warm and supple. Skin is warm and supple throughout with no lesions or tenderness. Shoulders are symmetrical. Trachea is midline. I'm gonna go ahead and listen to your lung sounds, okay? Take a deep breath. Okay, and now just the back side. Deep breaths. Okay. Upon auscultation of the anterior and posterior lung sounds are clear bilaterally with no adventition sounds noted. I'm gonna go ahead and look at your arms and your legs, okay? Upon inspection of the upper and lower extremities, skin matches that of ethnic background with no lesions or deformities, and limbs are symmetrical. Is it okay if I can touch you? Flip your hands. Okay. Upon palpation of the upper and lower extremities, skin is warm and supple throughout. Cap refill is less than 2 seconds. Radial and pedal pulses are 2+ equally, and no pretibial edema is noted. I'm gonna go ahead and do your GI. If you can go ahead and open your mouth for me. Okay, awesome. Under the tongue, perfect. Upon inspection of the oral cavity, teeth are tight and well defined with regular dentition. Mucosa and tongue are pink and moist. Tongue protrudes midline. Hard palate is white with irregular reggae. Soft palate is pink and moist. Tonsils are pink and moist, 2+, and no halitosis present. And go ahead and swallow for me. Swallowing is intact. I'm gonna go ahead and check your abdomen. Okay, I'm gonna go ahead and lift this up. Upon inspection of the abdomen, skin matches that of ethnic background with no lesions or deformities. Shape is flat, shape and contour is flat and is symmetrical, and umbilicus is midline. I'm gonna go ahead and listen, okay? Okay, upon auscultation, bowel sounds are active in all 4 quadrants. Is it okay if I can touch you? I'm gonna be doing light and deep palpations. Take a deep breath in, out. Okay, pitch in for turgor. Upon light and deep palpation with skin turgor, no tenting, lumps, masses, or tenderness noted, and no abnormalities noted. Okay, go ahead and stand up for me. We're gonna be doing your musculoskeletal system now, okay? Can you go ahead and extend up with your head? Flex down. Look to your left. Look to your right. Can you go ahead and raise your arms? Raise them down. Okay, we're gonna be doing the same motions, but with some resistance, okay? Forward, backwards, this side, raise your arms, down. Okay, with your elbows, can you flex them, extend them? Upwards, downwards. With your hands, place them like this. Can you flex them down? Hyperextend. Can you rotate them? Excellent. With your fingers, extend them, hyperextend, flexion, wiggle them. Can you go ahead and grab them? Perfect. Can you go ahead and touch your toes? All the way up? Perfect. Can you rotate? Excellent. Go ahead and sit down for me. Okay. Oh, sorry. So can you lay down? You're going to be testing range of motion with your legs, okay? Can you go ahead and, your legs are already extended. Can you bring one knee to your chest? Can you go inwards, outwards? Perfect. Bring it down. With the other leg, bring it to your chest. Outwards, inwards, bring it down. Same movements, but with resistance, okay? Upwards, downwards, bring it up. Inwards, outwards, perfect. Other leg, upwards, downwards, outwards, inwards, perfect. Go ahead and sit up for me. We're gonna be doing your feet, okay? Can you invert them? Exvert them? Can you plantar flexion, dorsal flexion? And then go ahead and stand up for me. Oh no, sorry, just sit down. Is it okay if I can touch you?
Yeah.
Okay. Open your mouth. Awesome. Is it okay if I can touch you?
Yeah.
Yeah, sorry. Okay. Upon inspection and palpation of the TMJ, cervical, lumbar, thoracic, shoulders, elbows, wrists, fingers, hips, knees, ankles, and feet and toe. Skin is warm throughout and supple. No lesions or deformities noted, no tenderness. Patient has full active range of motion, 5 out of 5. And thoracic and lumbar and cervical were not tested for range of motion. Okay, can you please demonstrate how to call me? Okay, is there anything else you may need from me?
No.
Okay, thank you so much.
Thank you.
I'll be back to check on you.
Yes.